2 types of traumatic fractures for ICD-10-CM coding. ICD-10-CM groups fractures into 2 general categories of cause, non-traumatic and traumatic. Non-traumatic fractures are reported from Chapter 13, Diseases of the Musculoskeletal System and Connective Tissue, and include those due to stress, diseases such as malignancy or osteoporosis, and atypical. Traumatic fractures are assigned to codes from Chapter 19, Injury, Poisoning, and Other Certain Consequences of External Causes, and are grouped into sections of codes for fractures within a specific body system. Trauma is the most common cause of fractures. Traumatic fractures occur when anything hits a healthy bone with enough force to break it. Traumatic fractures result from many different causes, such as car accidents, slips or trips, falls, and sports injuries. Not all fractures are the same. Different mechanisms of injury can result in different kinds of fractures. The nature of a fracture is referred to as its type. It's important to be familiar with different types of fractures because ICD-10-CM classifies some traumatic fractures according to type. Unlike traumatic fractures, type does not play a role when coding non-traumatic or pathological fractures. Fracture type or name describes a fracture according to characteristics, such as pattern of breakage in reference to the long axis of the bone, for example, a transverse fracture, presence of multiple fragments, such as a segmental fracture, and/or type of force that caused the fracture, such as a spiral fracture. A transverse fracture is one where the fracture line runs horizontally across the bone. Oblique fractures run in a line at an angle to the length of the bone. The ends of an oblique fracture may be aligned or they may be offset. Longitudinal fractures run along the length of the bone. Hairline or fissure fractures are incomplete fractures characterized by a thin crack in the bone rather than a complete break of the bone. Spiral fractures develop when twisting force is applied to the bone, leaving a corkscrew-shaped fracture line. In comminuted fractures, the bone within the fracture area is broken into 3 or more pieces, ranging from a few large pieces to many small pieces. Impacted fractures are caused by a compressive force driving the ends of the fractured bone into one another and causing the bone ends to become tightly wedged together. Typically, the hard outer cortical bone of one fragment is forced into the softer cancellous bone of the adjacent fragment, creating a surprisingly stable fracture. Avulsion fractures occur when the part of a bone that is attached to a tendon or ligament is forcibly pulled away from the rest of the bone. These fractures often occur near joints, where the parts of the bone that serve as an attachment point for tendons and ligaments are located. In segmental fractures, there are 2 separate complete fracture lines. The intervening section of bone becomes a free segment between the 2 fractures. Torus fractures are also called buccal fractures. They show up in X-rays as a bulge in the bone rather than a break. These incomplete fractures are common in children when one side of their softer bones is compressed and buckles, creating a bulge without breaking through. Greenstick fractures are another type of incomplete fracture commonly seen in children. In these fractures, softer bones bend and crack on one side rather than breaking completely. ICD-10-CM includes combination codes for some fractures that identify both the site and fracture type. For those fractures where there is not a combination code, including both site and a certain type of fracture, the classification prioritizes site over type. For instance, ICD-10-CM includes codes for transverse, oblique, spiral, comminuted or segmental fractures of the shaft of the long bones of the lower leg, the tibia and fibula. However, ICD-10-CM does not have codes for these types of fractures for the distal or proximal ends of these bones. In cases where these types of fractures occur at any site on these bones other than the shaft, the fracture is coded as an other fracture of the particular fracture site. For example, a comminuted fracture of the distal end of the right tibia is coded as S82.391, other fracture of lower end of right tibia, with a 7th character for type of encounter. Thanks for watching. Health Information Associates is committed to providing educational products that help coders be their best. So be sure to check out the other presentations on the HIA YouTube channel, as well as our full catalog of offerings at hialearn.com. Happy coding!